And welcome to the program. Thanks for joining us. No shortage of news this week, including the major announcement that there will be some changes at Arkansas Blue Cross Blue Shield. Or will there be changes that you'll notice? I am sitting down with Curtis Barnett for a conversation. Good to see you, sir.
Robbie, good to see you as always.
He's the CEO of Blue Cross and Blue Shield. Curtis, tell me a little bit about this Cambia affiliation and what does it mean?
Yeah, thank you, Robbie, for that. And really, I will take you back maybe about 3 years ago. So about 3 years ago, coming out of the pandemic, we began to look at across the horizon of healthcare, where things were going. And we could see a lot of the challenges that health insurers, payers, the overall healthcare industry is experiencing today. And we began thinking about how do we respond to that, how do we prepare ourselves for that so that we can be successful in this new environment. And we felt like then that we needed to be thinking about how do we partner with somebody in a very meaningful way, another company, another Blue Cross Blue Shield plan that is like-minded, has similar values, similar vision, who we have trust in, that we can work with in the future to really prepare us for this new environment when we think about all the challenges that healthcare is facing today. We brought that to fruition in the past week or so. Cambia Health Solutions. This is a company, the holding company that operates Blue Cross Blue Shield plans in the Pacific Northwest and also the Mountain West in 4 states. We have a long history of working with them very effectively, and we're looking forward to partnering with them in this new affiliation.
For business people that will remember this, is this a little bit like Entergy Arkansas being part of the holding company of Entergy Corporation, or is that analogy not necessarily apples to apples?
I don't know that it's apples to apples, and not as familiar with the Entergy example as you may be, but I think for us, it's really the organizations coming together, and so that we can share technology, so that we can share staff, so that we can share other resources, and that we can also leverage the best-in-class capabilities, overall expertise, so that we can be successful in multiple markets, but really with a strong focus here in the state of Arkansas, because Arkansas Blue Cross Blue Shield does not go away. This is a contractual relationship that we're entering into, so each of the entities remain independent. We continue to have our own fiduciary boards of directors that will help govern our organization. So really we're just coming together in a contractual way where we can share in a very impactful way.
The $650 million question, maybe even higher question than that, how does this affect people's health insurance?
It won't affect their health insurance. It's certainly not immediately. I mean, their Arkansas Blue Cross Blue Shield card will continue to work for them. They'll continue to be served by the same people local that they've always been served by. That doesn't change. But we think as we look into the future, we're going to be able to create more value for our customers. And so when you think about rising healthcare costs and what's driving those cost increases today, our ability to work with new analytics, new processes around how can we make sure that those services are appropriate and they're cost effective when they are provided, new payment models, all those things are going to be a part of this. And then new technology that will allow us to help our members be better navigators of healthcare, be better purchasers of healthcare and really empower them in ways that maybe we haven't been able to in the past.
Let's shift gears and talk about things that are affecting. You've brought it up, the things that are happening to cause health insurance premiums to increase. You gave a speech at the Clinton Center a little over a week ago, very informative and insightful on that. We reported on that. You got a lot of things that have been driving the higher cost of health insurance premiums. You've got technology costs increasing, you got more utilization, and I want to hear more about why there's more utilization. Right. And then we'll talk politically a little bit later on about this premium cliff that may be coming, a subsidy cliff that may be coming up. Tell me a little bit about why these factors are causing health insurance premiums to rise.
Yeah, and I think people need to keep in mind that if you want to limit the increase in health insurance premiums, you have to lower the cost of health care or impact the cost of overall health care. And so we are seeing growing utilization. A lot of that, we have an aging population. We've had poor health status as a country and as a state. And Roby, a few years ago, those problems seemed like they were here, and then now they're right here. I mean, we're seeing those play out on a daily basis.
Some of this delayed care from the pandemic as well. Delayed care from the
pandemic, we saw that as well. We've seen inflationary pressures and really the impact that that's had on some of the healthcare systems with regard to staffing and some of the pressures that they felt. So that's come to play. And then you've got pharmaceuticals, which we've talked about in the past. It's always a challenge. And that's the number one issue that we hear from our members is what can we do about the cost of pharmaceuticals and prescription drugs.
Arkansas did something in this last legislative session to affect PBMs. Do you think that's going to be effective? Do you see that happening in other states?
I think we do see some of that happening in other states, but I think where we need to really focus our efforts as a country is how can we take that up a step further, and that is really look at the prices that are being charged by big pharmaceutical companies, and can we impact those? And I know the president has looked at, most favored nations pricing, especially for Medicaid, maybe for Medicare. We need those same type of protections extended to the commercial markets as well.
We have a huge debate in Washington, D.C. that has led to a government shutdown. Democrats have said the subsidies that came about for health insurance premiums in the Affordable Care Act markets, excuse me, are about to expire. They want to see them extended. Republicans have said, open the government and then we'll talk, sort of thing. Not asking you to pick a side on this, so although you're welcome to if you wish. But just of the scenarios that could play out, what's the potential impact? And I'm presuming that you guys have factored in for next year already that the premiums are going to expire.
That's right. So the filings that have been approved so far do assume that the enhanced tax credits will not be approved, and so that was the basis for that, because we had to make a decision at some point. I tend to be an optimist on most things, and even on this subject. And certainly, the time frame is not what we would want it to be, given how late it is in the open enrollment period. But I do believe there's support on both sides. Certainly there is on the Democrat side. I think there is on the Republican side to find a way to extend the tax credits, if not completely, but at least in large part, and maybe for at least a 1 to 2 year period until we can decide maybe as a country where we want to go from there. So I do think there's that support there. I think the challenge is going to be is how do we get that implemented if it is passed? How do we get that implemented in such a way that the people who are buying those policies can feel the impact of that?
I might not share as much optimism as you have for a solution. I seem to feel like they're very entrenched in their positions, and I think their political bases are entrenched in their positions, and I'm just not sure what's going to swing them one way or the other. But I do think it's coming in terms of what may happen there. There's also been some calls from the state legislature. I referenced an interview I've done recently with Representative Lee Johnson of Greenwood, who says he wants to see more transparency on how insurance rates are even set, particularly in the state of Arkansas. What's your take on that call? I know you're an open transparency kind of guy. What could change, you think, to address where some legislative concerns are coming?
Yeah, I think part of it, we may just need to revisit really some of the changes that went into effect a little over 10 years ago with the Affordable Care Act. And our industry is highly regulated today, so we don't basically create premium increases or premium rates without the approval of the Arkansas Insurance Department. And it goes through a very extensive process as we work with them, with, in some cases, some independent outside actuarial firms who also look over those rates as well. So anytime we file for a rate increase, it is something that goes through extensive review, extensive levels, and it is not done lightly by any means, and there is a full sharing and understanding of what's driving those rate increases.
You think that's enough to satisfy legislators?
Not sure about that, but I do think that we do need to recognize it is a very regulated process today, and it is one that we're proud to participate in.
Got about 30 seconds left. We do have a new insurance commissioner,
Jimmy
Harris.
We do.
And I'll tell you a funny story. He used to be my shelter insurance agent. How about that? How's that full circle moment there for you there? What do you think of that appointment? Are you prepared to work with him? You probably worked with him some in the past because he's been involved in some of this regulatory.
We have, and we think that Commissioner Harris is an outstanding choice, and have had a chance to spend a little bit of time with him, and we look forward to working with him even more in the future.
I don't know if I'm going to be able to call him Commissioner Harris. He's just Jimmy to me. I mean, so, but he'll be happy to know that we've talked about him here today. Curtis Barnett is the CEO of Blue Cross Blue Shield here in Arkansas. Thank you for being with us. Congratulations on the new affiliation with Cambia. I look forward to seeing how that plays out.
Great. Thank you, Roby. Good to see you.
Thanks for being here. We will be back with more right after this word from our sponsors.